Here's a slide straight out of the economic forecasting from the American Institute of Architects. And I mentioned that because I wanted to sort of touch on the building sectors. You see that the commercial industrial has been the hardest hit based on the billing index for architects. And this is over a one-year period, so from last June to this June. Everyone took a dip, obviously, but residential seems to be climbing. Institutional, where our healthcare and federal work is sort of situated, is in between, and I would say that's been fairly steady. And just so if you're looking at the chart there, the 50 number gives you an indication of a healthy environment for architectural billing. So if we're below that line, we're negative. If we're above that line, we're positive. So you see, we still have a ways to go. And that's been vetted out in several other surveys and market data that the institutional, specifically healthcare, is probably going to be fine. We're seeing that in our healthcare work. Not only are we responding to COVID-19 specific needs for healthcare facilities, but we're still doing equipment replacements, MRI, CT scan type of things. We're still doing medical surgical unit renovations, still doing campus master plans. So I would say that particular area has not really let off at all. Where we have seen a lot of pullback is in the commercial side, certainly any kind of retail space, inline tenant fit out type of stuff, that really has gone away almost completely. So I do have a healthcare background. That's 10 years of practice before I started my own firm. And it's interesting, last year we were working on projects trying to get hospitals to meet the USP 800 compliance. And that's the compliance required for clean rooms, specifically hazardous drugs, usually related to the mixing of cancer drugs for patients. So that deadline was coming up, as you see there, December 1st, 2019. We're still doing a bunch of them because most of the hospitals cannot meet that deadline. They received an extension from their state pharmacy board, and what happened is the pandemic sort of came in there February, March, and all this sort of has gone by the wayside now in terms of meeting any critical deadline. So this work is still kind of in our rearview mirror, but important consideration, because I think there's a lot of lessons you can learn from a clean room pharmacy sort of tied to clean air environment, air changes, fresh air intake, those types of things. So we've tried to utilize our experience in this realm in providing USP compliance to facilities and think about how that might apply to non-healthcare facilities moving forward. Here's a rudimentary breakdown of the work of our firm. You see there, I mentioned traditional services. It's about half of our work, primary healthcare and federal. We decided about 5 years ago that we really wanted to make sure we had another line of billing, just because traditional services are constantly under attack, whether it's another entity like interior designers seeking licensure, or states trying to drop licensure requirements. It's just a dwindling service line to some degree. So in order to protect ourselves, we started thinking about other ways in which architects' education and background could provide a sort of positive, healthy business model. And so I want to touch on some of that work here. You see there, the education piece. I mentioned that I teach part-time. We have a research component. And then we also do sort of high-level strategic thinking, workshops with clients, try to get to them before they get to wanting a master plan that is tied to physical space. sort of helping them think through business planning, strategic planning that is not necessarily architectural, but usually leads to architectural projects. So one of these alternative lines is our interest in the IECC, the Energy Code. And a few years ago, when the 2015 IECC came out, we partnered with Newport Partners and the MEA, and we're traveling around the state educating both architects, engineers, so design professionals, as well as regulatory officials on implementation of the code. As you may recall, Maryland was the second state to adopt this, and it was very stringent at the time. Vermont was actually the first state to adopt it, but Maryland was the first to enforce it. So we were the guinea pig, and there was a lot of confusion amongst designers, builders, inspectors on how to implement and meet this code. So the grant money that's awarded from the MEA was an effort to try to find standardization, best practices, and share that throughout the state. And that's really where our interest in sort of tying the HVAC aspect of a building to the architecture took foothold. You see the 2015 IECC really forced us to tighten up our buildings, specifically residential, which weren't as buttoned up as before. Now, we might argue whether or not that's a good thing or a bad thing. From my perspective, in 10 years, we're going to figure out that we probably should have let the buildings breathe a little bit more than we do. But regardless, at this point, in order to get balanced ventilation, you're looking at whole house fans and exhaust systems, things you never had to do before or even consider in residential applications. So we're always looking for innovative, inexpensive ways that we can meet that. So if you all know of any of those, I'd be happy to hear from you on that. And we do a significant amount of residential work, even though we don't really market that. As you're probably aware, there is a very rich sort of market on the Eastern Shore and in and around Annapolis for custom high-end residential work. And that makes that requirement of ventilation even more challenging. In most of these residences, you have waterfront views. The client wants as much glass, whether it's floor to ceiling or wall to wall, in every room that faces the water. They paid for that view. They want to be able to look at it. So how do you keep condensation off of that glass without going to full grade commercial systems? How do you hide those supplies so that they're not unsightly and don't look mechanical or commercial? Those are some of the challenges that we find in the custom residential world related to HVAC. One of the other things we're doing as a non-traditional practice is energy modeling and energy studies for clients. And that's taking an existing building, usually it's an old building, as you can see here in this example in the upper left, and trying to provide the best value proposition for energy use for the building. And that solution is never just architectural or mechanical or electrical. It's usually a combination of all three, and thinking through what is kind of the low-hanging fruit, what are the options that don't require a comprehensive interior renovation where you're basically gutting the interior and starting over. What are the steps you can take to build up the most highest energy efficiency use without having to basically double the cost of the building? So we start with a facility assessment that just provides a basic value for replacement and use that as a benchmark for how much money does it make sense to spend on energy conservation. So this is thinking not just about design on the front end, but in the back end, and also considering, occupancy and use and what opportunities in terms of grants and pay downs might be available in the market, if we're speaking about electric. And also, the sustainability of the systems. We do some clean energy work involving solar photovoltaics, geothermal, that kind of thing. But you see here, this has become quite a sophisticated practice. A lot of quantitative data here being thrown at you. So trying to make sense out of this and make a decision based on highest value is not always easy. And this is where we really need our mechanical partners to work with us hand in hand in this modeling to figure out what is the best system in terms of lowest cost with highest return on efficiency. I mentioned facility assessments as well. That's a market that architects traditionally have not really delved into. Usually there are smaller kind of engineering firms, I would say, that specialize in this. We've tried to get into this market, so providing not just quantitative data, but also qualitative data of buildings and areas as well. So what you would typically get is a list of projects. For example, the boiler is at the end of its life and must be replaced within 3 years. The electrical panel needs to be upgraded. The ramp is not ADA compliant. So a list of projects and a budget associated with that. This tries to take that one step further and talk about the qualitative aspects of a building and how we can improve on those as well. So it's not discounting the quantitative output that you would get from a traditional facility assessment, but it's trying to take that in concert with, what is the building today, what could it be, and how can it be best used. What's been interesting about these projects, and I wanted to point out to you all, you can see kind of right there in the middle with the blue bars, 82% in this particular instance of the building asset cost is related to major building systems. So what we're seeing is that while the building envelopes through thermal and moisture protection are in pretty good shape, so clients have come back and replaced roofs, replaced windows, watertight certain eaves and areas around the building. What they've ignored in large part is the building systems, and we're to a point now where these things can't be saved, that we really need comprehensive new building systems. And I think that's going to be a challenge for owners, specifically in campus environments where there's several buildings. It's difficult to be able to get into these buildings because they're constantly occupied. So how can we, is there a way to provide a building system upgrade that doesn't involve a full comprehensive, reconstruct scenario? And that's always the challenge. Here's another slide out of the AIA's forecasting. You saw the slide before, or the graph before in the lower left hand related to the billing index. This tries to break it down by geography. You see the Northeast was most heavily hit, which isn't unexpected, and the South as well. And you can kind of map that to the slide I showed you earlier, where the coronavirus is most prevalent. Outside of California, you can see that it's really the Northeast and the South that they're being hit the hardest. And here's some additional data on construction forecasting. This is very recent, this month. And what the AIA does is take several sources and try to conglomerate all that information into a forecast moving into next year. And if you're looking at the red portion, you're seeing the projected change as a percentage. And again, the commercial, the hotel, and amusement and recreation, all things directly affected by the pandemic, in double digits. And we don't see that really changing too much, but drops across the board. Luckily, institutional healthcare, education, very minor, but you see that if you're going from 2020 to 2021, it's not just a 1.7, for instance, for institutional. It's already being down 4.5 and moving another 1.7 as a percentage. So although I wouldn't say it's completely bleak, there is a lot of recovery that we're going to need in order to keep things going. So we'll hope for the best here moving into the fall and the flu season for sure. And then lastly here is the actual Architecture Billing Index. This is the primary data feedback loop that the AIA provides as a resource for an economic indicator. So you can see the dip in March of this year directly related to the shutdown nationwide. Just as a side note, that dip from what was about 52 to 24 or so was the biggest drop that the Architecture Billing Index has ever seen in its existence. So it was significant. It was like jumping off a cliff. We have climbed back, thankfully. You see there that the inquiries are back. So that's clients either asking for proposals, RFPs coming out, those types of things. Project kind of scuttlebutt on the front end and people providing proposals. The gray line is the actual contracts. So you see the contracts usually is below the yellow line in most cases, because inquiries are usually ahead of contracts. But we have seen a steady climb back. So that's what the encouraging part of this is even though I feel like we're still right in the middle of the pandemic to some degree, at least from an architectural perspective, we are still getting a lot of phone calls. As I said, our healthcare sector is very healthy. Our federal sector is also very healthy. And we're even starting to get some calls about residential work. So I'm not sure if people have decided they're going to move on and kind of just figure this out. But there has been a nice steady climb here that hopefully continues and gets us back up to 50 and over, moving into the fall with the election coming. And as I mentioned before, the uncertainty around how the flu season might overlap this is I think, the next fear for most of our healthcare clients in terms of surge capacity and what that might mean in hospitals and also in senior living and senior care. So that's what I have for you today. I hope you enjoyed the presentation. As I said before, there's a lot of touch points that I feel like we need to be working and collaborating with mechanical contractors, designers, people in the industry. So if you do have any feedback or any thoughts on any of those specific instances, I'd love to hear from you. Otherwise, I'll turn it back over to Chuck and Melissa and try to answer any questions or take any comments.
Thank you so much, Jason. That was great, actually. So if anyone has any questions, like I said, please, now's your chance. Please enter them in the question portion of the screen, and we'll take care of it. Chuck, do you have a question? Yeah.
Jason, thanks again. It's really outstanding. Just curious about, there was a report that actually came out before COVID-19, which is daunting to say the least, that concluded, and it was a, you know, it was, there were some that pushed back against the conclusion, but essentially 1/3 of four-year liberal arts colleges are at risk of failing financially. Again, that's before COVID-19. Is that something that you've ever, AIA's ever thought about? You know, if we do get to a point where some of these colleges are closing in mass or consolidation kind of thing?
Yeah, that's a great question, Chuck. I have also seen that. We've felt it a little bit with some of our clientele. You know, these liberal arts colleges, that their campuses have buildings that are, in some cases, you know, 50, 60 years old, and they're well past their useful life. And you know, students living now in a compromised environment is a liability. And so there's a lot of concern around that from just the physical building side. That alone with having a flooded market, at least from what I've seen, kind of with academic opportunity, and also the advent of virtual learning, at least at the collegiate level, has really put a strain on most universities to provide outstanding, well beyond, you know, probably what you and I had in terms of services to students. We're talking about, you know, fitness gyms and amenities, cafeterias in the dorm room, things that just aren't sustainable from a financial perspective. And so I do think there is a bubble there that is going to need to be addressed in some capacity. I'm not sure what the solution is. You've probably seen that some universities are starting to partner or merger in some cases, trying to share programs between each other. I know just in Baltimore, you know, Micah and Johns Hopkins has a really interesting kind of program that they work between each other on a couple fronts. Maryland does the same. And so I'm not sure once we get through this fall season, and that's another challenge for the schools. You know, some universities have decided that they're going to go to virtual learning, and they've kind of left it at that. Others, as you saw in the presentation, that they're insistent on kids coming back in the fall. And unfortunately, that is partially probably due to financial pressure, that having the kid in the dorm room, having the full meal plan and being on campus is a much more economically viable situation than trying to provide virtual learning and only paying for credits of education as opposed to living. It'll be interesting to see how that pans out and what we do moving into the following year. As I mentioned there with the dormitory situation, I think that's just the beginning. I think most universities are going to have to rethink everything, whether they go to some sort of hybrid program, which is partial physical, partial online, like some of the MBA programs you've seen. You know, something like that might become standard. And so certainly the influx of competition is, I think, the biggest challenge, and finding ways in which you can differentiate your educational offerings becomes important. It's now an issue of branding, really, and what am I going to get from this? So really good point, and something that we'll certainly be thinking about as we move into our work that usually starts January, February, because all the work needs to be completed in the summer, you know, before kids come back to school in the fall. That's usually when our design work starts for most universities. So I think that we'll see what they intend to do, whether they back off of being physically present, or they double down and really maybe start to go to, you know, an all private dorm room model, which would be really quite a financial burden, but might also give, you know, parents and teachers, students peace of mind that they need in wake of the pandemic.
Thank you, Jason. You know, one other question, you alluded to it earlier in your presentation about 2015 that Maryland has not been, Maryland's not a newcomer to, low emissions construction. This region, obviously, Maryland is a signatory to the Regional Greenhouse Gas Initiative, RGGI, and there's talk of Maryland being in 2030 or 2040, I can't recall, being basically a zero net emissions state, and that seems to be a trend. If the election goes a certain way, maybe we adopt a national cap and trade. But I think so I think a lot of our members are fearful, but are some look at it as an opportunity. What's the give us our membership some sense of direction, and should they be positive about this? I think, should they be embracing this new technology, or should they fear new mandates?
Yeah, that's a good one. I think for the state of Maryland in particular, it is a real opportunity. Mostly because, as you mentioned, Maryland is going to be in front of any curve or any trend in this regard. So we have the power to figure it out and in some ways direct the solutions and the conversation. And that was what was really interesting for me personally about the IECC training, was that during those presentations, the back end of those was more of a conversation about how do I do this blower test, and what are some of the things I need to look out for, and people were sharing information in the audience that was really valuable, and we were taking that back and including that in our next presentation as lessons learned and best practices. And it's only going to get more stringent, at least from my perspective, from the HVAC side. So it's not going to be less work, it's going to be more comprehensive, even if it's tied to clean energy or sustainable measures. The quality of air has become such an important topic that it's not just tied to hospitals and senior living anymore. I think it's tied to all building types. And you can see that in the presentation today, certainly in academia, not just at the university level, but primary schools as well. The quality of the air is going to be a major concern for students across the board. But I think even in homes moving forward, you saw there with I mentioned the whole house exhaust and things we have to do with these homes that are now buttoned up so tight because everyone's fearful of the cost of energy. And that's really what's driving it, I believe, that we're getting our values and building envelopes that we've never seen before, that are just going to put more demand on really innovative HVAC systems that can support that type of architecture. So I wouldn't be discouraged by that in terms of a movement or regulations that might come down the pike. I think that would be an opportunity. Like I said, I really believe that moving forward, the design process needs to really become collaborative between architect and engineer, those folks designing building systems, and subcontractor to some degree. The implementation with boots on the ground is also the feedback loop that the design community needs in order to understand the implications of the lines they're putting on paper.
That's a great perspective, Jason. Thank you. And just to let the people that follow along with the presentation, they can see your contact information. But for those that called in, for whatever reason, would you be able to share your contact information if they need to reach out to you?
Yes, I'd be happy to, Chuck. Thank you. My email address is jwinters, WINTERS, @kezlo.com, and that's KEZLO.com. And you can always reach me at 443-569-1940. And if you do have any feedback on this presentation, I'd love to hear from you. Like I said, we're looking for solutions that involve feedback from HVAC expertise. So any thoughts or solutions or challenges that you're thinking about or seeing in the field, we'd love to hear about that.
Thank you, Jason, so much.
Thank you, everyone. Have a great day. And Jason, thank you for your time, and we truly appreciate it.
Thank you, Melissa. It's been a pleasure. Hope everyone has a great day.
Okay, take care, everyone.